Good evening, everybody. Thank you. Welcome to the Bennington Forum on Oral Health and Water Fluoridation. I am Greg Van Houten, your Select Board Chair. Tonight we are here to discuss a recommendation by the Bennington Oral Health Coalition to increase the level of fluoride in the Bennington municipal water system from 0.01 parts per million to 0.07 parts per million, a level recommended to increase resistance to tooth decay. But the Bennington Oral Health Coalition is a subcommittee that came out of the community meetings 3 years ago. They were hosted by the town of Bennington along with the Vermont Council on Rural Development. After several well-attended and vigorous meetings in 2012, the community identified a prioritized list of issues we wanted to address in Bennington and formed action groups to pursue solutions. The Oral Health Coalition is made up of medical professionals and lay folks who have been working on a volunteer basis to address some of the previously unattended needs of the people of Bennington. We will begin this with a short presentation by the coalition to explain how they arrived at this recommendation. Following that presentation, our moderator, Andrew McKeever, will introduce a panel of credentialed professionals to answer questions and comment on aspects of municipal water fluoridation. The goal of this forum is to provide the citizens of Bennington with clear information on what is an important and emotional issue for many. Certainly, our water system is an essential component of our town. A 2-hour forum will not be able to contain all of the questions and details that go along with this topic. It will, however, allow us to set a foundation for citizens to build on and hopefully come to a comfortable decision in time for town meeting day. On March 3rd, citizens of Bennington, North Bennington, and Old Bennington will be asked to vote an advisory question, which you see in the front of the room over here. Shall the town of Bennington adjust the natural level of fluoride in the Bennington water system to a level recommended for preventing tooth decay? The panel we have assembled is equipped to answer questions on different aspects of fluoridation. There are, of course, philosophical questions that we must answer for ourselves. To do that, it is important to have a grasp on the science of the day and the practical issues of fluoridation. The Bennington Select Board serves not only as the legislative body of the town, but also as the Water Board and the Board of Health. It is important for us to get good feedback on what the priorities of the residents are. Please take note of this issue. Do some research and be sure to register by February 25th, and vote on March 3rd. I want to take this opportunity to thank our media partners, the volunteers in the Oral Health Coalition for their work, the panelists who are assembled on our behalf, and our moderator. To all of you who are here watching on Catamount Access TV or listening on WBTN AM, fluoridation, one way or the other, is not the only solution to our health issues. We will discuss this as neighbors, and we will leave as neighbors with work to do. Thank you all for your interest in our community. I want to just tell you right now, one of our panelists, Dr. Judy Orton, is delayed. She is helping someone have a baby, apparently. So, I want to introduce our Oral Health Coalition now. They're going to do their presentation, so I want to bring up Charlie Gingo. Thank you, everyone.
Good evening, everyone. My name is Charlie Gingo. I live here in Bennington. I'm on the water system, and I'm a member of the Bennington Oral Health Coalition. The coalition has been asked, why did you start with this idea of recommending the fluoridation of the Bennington water system? And what I wanted you to know is that we didn't start there. It's where we arrived after 3 years of doing some very concrete things in the community to improve the oral health of Bennington residents. So I want to tell you about some of those things that we've done, and some of them we're still doing. We've worked with several of the local food pantries and the Vermont Food Bank to acquire toothbrushes and tubes of toothpaste to distribute to the guests of the various pantries. And during the past 3 years, we've distributed thousands of toothbrushes and tubes of toothpaste to families in Bennington. We've worked with the state of Vermont and a local oral surgery practice to increase the number of state dental vouchers that are used to alleviate adults' pain and suffering. These dental vouchers are typically used when an eligible person is experiencing severe dental pain, including bleeding, and needs to have one or more teeth pulled. We've worked with the Greater Bennington Interfaith Community Services. They run the free clinic, the Food and Fuel Fund, and the Kitchen Cupboard, among some other programs. And we worked with them to establish a fund to help pay for some restorative dental work, and typically getting cavities filled for free clinic patients. We set up an arrangement with a local dental practice to see patients that have been referred by the free clinic. We've worked with local oral health professionals to set up the free dental day here in Bennington. And for folks who aren't aware, that free dental day, our local dentists, their staff, and others volunteer to work with people who need teeth pulled. We're organizing another day in this calendar year, and it's tentatively set for Saturday, April 25th. We've talked with the University of Vermont about the wild-eyed possibility of establishing a dental school down here. They smiled at us. The costs to do such a thing are prohibitive. We've talked with Vermont Technical College about the possibility of setting up a dental hygienist training program here in the community to address the earliest kinds of prevention work that people in our community need. Again, costs are very substantial. We talked with Hudson Valley Community College over in the Albany area about the possibility of sending Bennington residents to their dental clinics. Those clinics that Hudson Valley offers through their dental hygiene training program. They're staffed by dentists and student hygienists, and you can have an evaluation, you can get your teeth cleaned, they do fluoride treatment, they do x-rays. They're amenable to this happening. We've long heard the anecdotal stories about how severe the dental problems of Bennington's children and adults are. So we began researching to find out the facts about how widespread and how severe the problem actually is. And folks, I gotta tell you, we were stunned by the breadth and the depth of the problem in our town with our children and our adults. You may hear some of those statistics this evening. We're in the early stages of developing dental education programs to present to children and adults across the community that focus on good nutrition and good oral health. So while continuing to do these kinds of things, the coalition came to realize that we were not going to be able to fund our way out of this problem. We didn't have the financial resources to really address the severity of this public health issue in our community that affects people across the full socioeconomic spectrum. Dental disease doesn't care if you're poor, if you're middle class, or if you're a person of means. We realized that we can't just keep pulling teeth to find our way out of this problem. We had to do something that is safe, that is scientifically sound, that is systemic, and that's economical, about preventing the problem that leads to our children having teeth pulled in our local hospitals' operating rooms, and adults having to deal with their dental pain and suffering until they can get that tooth pulled. we asked, how can we help stem the problem? And how might we be able to prevent the problem in the first place? After a lot, and let me tell you, it's been a lot of careful research, we came to the conclusion there really is one surefire way to begin to address the problem, to actually make life better for us, for our children, for our grandchildren. And that, at that point, it was to pursue the matter of fluoridating the Bennington water supply. We realized very early on that while there is broad support to fluoridate Bennington's water across the community, there are also folks, some of our neighbors, some of our friends, who are really afraid of this. When I'm afraid of something, my feelings and my instincts can often just smother what the facts are. And I know that about myself. So when I'm afraid, one of the things that I try to do is work off of this principle, to ask questions, to listen carefully, to learn more, and to make a more informed decision. And I hope that's why you're here this evening, to ask and to listen and to learn more and to, in essence, decide better. Because it all boils down to this. When it comes to your health and your children's health, who are you going to believe? Who are you going to trust? Your doctor? Your child's pediatrician? Your dentist? Or someone who helps you keep feeling afraid? Let me turn the floor over to Andrew McKeever, the moderator for this evening's forum.
Thank you, Charlie. It's my pleasure to be here tonight. Great to be back in Bennington, where I spent a few happy years at Mount Anthony just a few years ago. Seems like only yesterday anyway. And also more recently worked at the Bennington Banner as a reporter and arts editor. It's my pleasure to serve as your moderator tonight for what I'm sure is going to be an informative and interesting evening. I just wanted to lay out a few of the ground rules before we get started, and then I'll introduce our panel and we'll get underway. First of all, the question and answer period, which will follow the panelist presentation. If you want to ask a question, and there are already several that have been sort of set up beforehand, go to the back table there. You'll get a number, and then I will randomly draw numbers as we get on towards that part of the program. And if I call your number, come up here to this mic over here, and you can ask your question. You'll have 1 minute to ask your question, so no speeches, please. We'll keep it as short as we can so we can get to the answers. The other thing is, I've been asked just to say, if you do have a question, or please, we want to try and keep it as a civil, orderly evening, so just be respectful when other folks have questions, and everyone will have their turn to kind of, ask what they need. Okay, I think that's about everything as that goes. Each panelist will have 4 minutes to make their presentation. We have a timekeeper here, so when we get up to that mark, we have some signage ready to go, so that panelists, if you need to complete a thought, we'll give you 5 seconds or so to kind of wrap it up, but time is kind of critical here, so we'll try and keep things as succinct as possible. On that note, let me introduce the panel. We have a really distinguished group of folks here who I think you're all going to find very interesting to hear from. Going from your left, the audience, on the far end there we have Robin Miller, who is the Interim Oral Health Director of the Vermont Department of Health. Next to her is Dr. James Tremarchi, the Director of Planning at the Southwest Vermont Medical Center. Next to him was Sarah Vos, Dr. Sarah Vos, Vermont State Toxicologist of the Vermont Department of Health. And it looks like Dr. Judy Orden didn't make it here. I guess she had more important things to do tonight, but we'll forgive her for that. But she may be showing up later, I guess, so we'll keep her in mind. Then we have Dr. Michael Brady, I think is well known to everyone here in town. He's the pediatric dentist, Molly Stark Dentistry. Then David Vincent, who's a chiropractor in private practice here in Bennington. Trey Dobson, the emergency room physician and chief medical officer at Southwest Vermont Medical Center. And last but hardly least, Jason Dolmich. Did I get that right? Oh, thank God. He's a consulting engineer at MSK Engineering. So again, each one of them will have 4 minutes to speak. We'll go through the panel basically, from left to right. When we come to the end of that, by then I'm sure we'll have some questions from you folks. I have a couple of questions, like I said, already in the hopper. So I'm sure this is going to be a fascinating evening, and let's get right to it without any further ado. Dr. Miller.
Hello. Hi, my name is Robin Miller. I am the Interim Oral Health Director at the Vermont Department of Health. I've been a registered dental hygienist for 18 years, and I've worked at the Health Department for 16 years. Thank you for inviting me here this evening to help answer questions about community water fluoridation. Fluoride is a mineral that's found in nearly all water sources. Water fluoridation is the practice of adjusting the level of existing fluoride in water to the recommended optimal level of 0.7 parts per million to prevent tooth decay. On January 25th of this year, America celebrated its 70th anniversary of community water fluoridation, a safe and effective way to prevent tooth decay. In fact, community water fluoridation is considered one of the 10 most important public health achievements of the previous century. Fluoridated water works in 2 ways. First, for children, fluoride is incorporated into the enamel of the developing teeth. Secondly, for people of all ages, trace amounts of fluoride is incorporated into the saliva that bathes the teeth. Saliva neutralizes the acid made by the bacteria that causes the decay process, and as the acid is neutralized, the fluoride is absorbed by the tooth and the enamel gets stronger. At the Vermont Department of Health, we work hard to reduce the burden of oral disease and to promote oral health for all Vermonters. Community water fluoridation is considered a gold standard for improving oral health and is an evidence-based best practice. Other evidence-based best practices that you probably know about include laws mandating seatbelt use, enhanced physical education in school, and smoke-free policies for workplaces. Children today have much less tooth decay than they did 40 or 50 years ago, in large part because of community water fluoridation. Still, tooth decay is one of the most common chronic diseases of childhood. It's even more common than asthma. Tooth decay is a disease. It's not like the cold or a flu, which goes away with time and bed rest. Unlike other diseases, tooth decay gets progressively worse unless it's treated. Of course, the best approach is to prevent it from happening in the first place, and community water fluoridation can help with that. Within the past 5 years, studies have shown that children with dental problems are more likely to miss school and are more likely to earn below average grades. In 2009, Vermont spent over $2.5 million treating dental decay in hospital settings for children under the age of 6. But it's not just about children. Data shows that it's much harder to get a good job for adults if they show up at an interview with unhealthy or missing teeth. And in addition, there's an established connection between oral health and diabetes. Poor oral health makes diabetes more difficult to control, and uncontrolled diabetes puts people at greater risk for oral disease. In 2013, Vermont spent almost $2 million treating emergency dental pain and infection with general assistance vouchers. In 2009, Vermont spent over $2.5 million treating dental issues in the ER. But now for the good news. We've learned a lot about how to prevent cavities over the past 70 years. Brushing with fluoridated toothpaste is important. So is eating a healthy diet by limiting sugar and getting dental sealants. But fluoridated water is a crucial part of the approach to prevent cavities. There are a variety of ways to get fluoride, including toothpaste, mouth rinse, tablets, and fluoridated water. Fluoridating water is the safest, most regulated, best possible way to get the fluoride that helps our teeth, and thousands of studies demonstrate this. A number of those studies have been conducted within the past 5 years. For example, a Nevada study found that living in a community without fluoridated water was one of the 3 highest. I have to wrap it up. Thank you.
Thank you, Dr. Miller. Our next panelist is Dr. James Tremarchi.
Good evening, folks. I'm Jim Tremarchi. I'm the Director of Planning and Business Development for the health system for Southwestern Vermont Healthcare. I won't make my comments long. I really only have 3 really short comments to make. The first comment is that the medical staff at Southwestern Vermont Medical Center endorses the fluoridation of Bennington's water supply. So your own doctors in your own community support fluoridating our water supply. The second point that I want to make is that as an institution, we believe that fluoridating the water will actually reduce healthcare spending by reducing spending on dental care. And then the last point that I want to make is that it aligns with our mission of improving overall health in the community. Oftentimes, dental problems lead subsequently to medical problems. So if we can stem the tide of dental problems, it will stem the tide of medical problems, which will reduce healthcare spending and lead to an overall healthier community. Really, my last point that I want to make is, as an institution, as your local healthcare institution, we believe very, very strongly that it is our role to try to get accurate information about the most pressing health needs out to the community. And that's why we're participating in this panel. We feel as though it's our role to try to provide accurate information. And I'm excited to hear the questions tonight and try to answer those.
Thank you, Dr. Tremarchi. Our next panelist is Dr. Sarah Vose, Vermont State Toxicologist.
Hi. So I want to start by telling you what my role is at the Department of Health. So I'm a toxicologist. I study poisons, and my role at the health department is to review chemicals and to review scientific literature and to review what's out there in the science and to interpret that so that everybody can understand what the science says. So I'm here because I've been contacted by many people who have concerns about fluoride and whether or not it's toxic in your drinking water. And people have asked that I watch certain videos that explain positions. So I have watched those, and I've prepared a summary of some of the studies that have been presented. So I won't get through them all in this first introduction, but I hope that during the question and answer period we can discuss more of these. Probably the biggest thing that people cite is a concern over a decrease in IQ. Some of this concern comes from a meta-analysis, which is a study of a lot of studies that were done in places that have naturally high fluoride, places like China and India, places where the people there are farmers and they have a very different lifestyle from ours. And in some of those populations where the fluoride was naturally high, anywhere from 2 to 10 mg per liter, so this is much higher than what's being discussed here, which is 0.7 mg per liter. Some of those studies did show an association between the fluoride and decreased IQ. I think we have to be cautious about interpreting some of that data and trying to relate it to community water fluoridation. There's a really good study on the effect of community water fluoridation and IQ that was done and just published last year in New Zealand. So unlike the studies that have looked at the children and the people living in rural China and India, the study from New Zealand looked at 1,000 people. And they followed these 1,000 people either from a fluoridated drinking water community, which is about the same concentration as what you're discussing here, or a non-fluoridated community. And they started testing their IQ at 3 years old, and they followed their IQ until the people were 38. So in those 38 years, they tested the IQ 12 different times, and they did not find an association between IQ and drinking water fluoridation. So that's just one example of, looking at the science and trying to pick the best types of studies to answer the questions and answer the concerns that people have about community water fluoridation. So I have several other topics that I read about, and I can discuss those later. But in general, when I'm looking at all these different studies, there's a big difference in talking about fluoride in places where it's naturally occurring at 10 mg per liter versus what we see in community water fluoridation at 0.7 mg per liter. So the scientific data do not support any toxicity or any health effects to be expected at the levels that we're talking about in community water fluoridation. So I have lots of papers. I'm happy to share papers with anyone who has questions. So I look forward to the discussion portion.
Thank you. Our next panelist is Dr. Michael Brady, a pediatric dentist here in town.
Green light on now? There we go, okay. Thank you. As I said, as Charlie said, when I had that private practice, I didn't realize, quite frankly, the depth of the problem in the town. The school district knew it, the nurses especially knew it, the hospital knew it because they were seeing the emergency room. And when I left my private practice after 25 years, Sue McGuire approached me, as she was the principal at Molly Stark at that point, and she suggested that we create a dental clinic at Molly Stark and take care of the kids right in the school. I've been doing that for 15 years. We started hopefully having a treatment class of about 300 kids. It quickly grew to 800 children, and quite frankly is bigger than we can handle because of the small size of our clinic. The problem with oral health is multifaceted, certainly. We're going to talk about that in detail later. But I do want to give you an idea of the cost that we're talking about to us as taxpayers. In Vermont, the care in the emergency rooms to Medicaid is about $2.5 million. The general assistant vouchers that Charlie mentioned too are $2.5 million. And the dental treatment in hospitals for children under 6 is about $2.5 million. So as taxpayers, we're spending in the state of Vermont about $7.5 million in dental care that can be prevented. In Bennington in particular, the emergency room care is about 600 visits at $500 a visit if you have a toothache, and that's $300,000. The general assistance vouchers are $173,000. The dental treatment in our OR here at Southern Vermont Medical Center is about 150 cases at about $4,000 a case when you count all the costs. That's $600,000. And the Medicaid payments that are paid to local dentists for their treatment are about $700,000. That's a total in Bennington of spending our tax dollars for dental disease of $1,773,000. If we reduce that by 30% through water fluoridation, which I firmly believe we can, that would save over $500,000 of our tax dollars. When you consider that water fluoridation costs about 50 cents to $3 a year for each individual on the water system, depending on the size of the water system, it seems like to me that's a very good investment. I'll leave it at that at this point.
Thank you, Dr. Brady. Just as a reminder, if any of you have some questions you'd like to get lined up, feel free to go back to the folks there at the table at the back and get your number, and you'll get in line. Our next speaker is Dr. David Vincent, who's a chiropractor here in private practice in Bennington.
I am David Vincent. Green button. I was asked to be on this panel to represent the natural health community, and I won't even pretend to be an expert on fluoride, but I took an approach, as I would in my own personal practice, to this issue. And I asked myself if it would be helpful in preventing the problem at hand. I asked myself, are there any potential problems long and short term? And then I asked myself, does fluoride interact with the other medications or foods? I take that very seriously in the sense that, like all of us here, we've taken a Hippocratic oath, basically, above all, do no harm. So even if we can, we have to ask the question, should we? And in this situation, I think all of us as citizens and practitioners are basically going to be acting as the doctors. We're going to say to our neighbors, we're going to be doing this as a community. We're going to be doing this together. We're going to make this decision together. So I think we all should be informed on that. So that's why I try to do it myself. It's clear that within those parameters that we're talking about, 0.7 to 1.2, in that parts per million, that it definitely prevents dental caries. It's been shown study after study to some extent. I think Dr. Brady has sort of targeted 30%. We know it's in between 20 and 40. That will be reduced. The concerns are, does it affect us long term? We know that fluoride is highly bioavailable. Our body absorbs it, loves it. Our bones love it. Our teeth love it. What does that do to us long term? We know that in some studies that it increases bone density, which causes increased fractures. We know that it causes fluorosis, which is a discoloration of teeth. Most of us may or may not care. It may affect that job interview we were talking about earlier. And then there's always the question about neurotoxicity. So there are questions there. The last question I asked myself, does it interact with any foods or medications? We know that fluoride interacts pretty heavily with aluminum and calcium and things like that. So right away, different antacids that may include either of those that are a problem. And for someone like myself that's on a low salt diet, I know that I'm going to really absorb fluoride into my body just because that's how we're set up. So hopefully over this night we can answer some of those concerns that we might have for each other and make a really good decision.
Thank you, Dr. Vincent. Our next panelist is Dr. Trey Dobson, the emergency room physician and chief medical officer at Southern Vermont Medical Center.
Am I on? So I have to talk to whoever set up this panel because you put me so far on the left. I have nothing new to say. My notes are useless. So let me talk a little bit about, I'll try to expand upon some of those comments. So as an emergency physician, as you would imagine, we see patients all the time that have problems related to dental caries. In the acute setting, that's a dental abscess. But let me tell you, that's not what I'm so concerned about. What I'm concerned about are the social and medical aspects that you don't think about day to day with dental caries. So kids that develop dental caries up into their teens, they don't smile. They learn not to smile. That hurts their social development, it hurts their relationships with their peers, it hurts their job interview that we were just discussing. And there's many other ways you could extrapolate that socially. But medically, when you have dental caries that repeatedly occur, not just one toothache that we all get, but repeated dental caries, repeated swelling of the gums, bleeding, you get bacteria in the blood. When you get bacteria in the blood, you have an inflammatory response. Normally your body can handle that. But when it happens over and over again, you can get sick with infections. But more importantly, you can have diseases that you wouldn't even think are related to dental caries. And the biggest one is atherosclerotic disease of the heart, coronary artery disease. At first, it was felt that it was just associated. People that had bad hearts had bad teeth because they had bad education or high salt diets or just bad genetics, and all of those are true. But it's pretty clear that dental caries lead to some percentage of chronic illness. That's where the dollars that Dr. Brady was talking about really go up in treating those. So You've heard about how fluoride can reduce dental caries by 30%. We have no idea how much it could reduce heart disease and other inflammatory. But we do know it's in the positive. We know it's a naturally occurring mineral. There are many minerals that in low concentration are damaging to our health and in high concentration are damaging to our health. You can think of those: magnesium, selenium, fluoride's one of those. And the levels that you talk about in fluoridating water are not at those extreme levels by any means. In fact, they're at a level that's shown to help with dental decay. So, Jim Trimarchi mentioned that the medical staff at the hospital, who I'm here to represent, highly endorse fluoridation of water. Other major organizations, the Centers for Disease Control and Prevention, the American Academy of Pediatrics, the American Academy of Family Physicians, all support this, and they have one common mission, and that's just to improve the overall health of the population. There are no other confounding factors there. So that's all I'm saying.
And our last panelist is Jason Dolmich, the consulting engineer at MSK Engineering.
Good evening. I have the honored position of being the PE on the board, which I see my role in this panel. I work closely with the Town of Bennington Water Resources Department to help them with their facilities and distribution-related activities. And I see myself here tonight to solely answer questions with respect to operational and distribution-related questions. I'm here not as an advocate for either position, but rather to help educate anybody on the nitty-gritty task of providing any kind of additive or a process.
Okay, well, that concludes the panel presentation. Now we get to, I suppose, the interesting part of the show tonight, the questions and answers. And by random chance, the first question is one that I think should be one that's on the minds of everyone here, and we're going to throw this one to Dr. Brady. This is a toughie, okay, but I think you'll be able to handle it. What is fluoride, and how does it work?
I think most of the audience has worked on this already, and Robin did introduce it. To make it quick, because we could spend a half an hour on that type of subject, actually, if we delved into it. Fluoride is a naturally occurring element. If you remember your high school chemistry, it's a periodic chart. It's magnesium, zinc, gold, silver, fluoride. They're all there. It's naturally occurring in the Earth's crust. It's naturally occurring in all our water supplies. The reason for that is rainwater goes over ground, dissolves some of the dirt, goes into the water systems, and we wind up with a level of fluoride ranging from, in Bennington, 0.1 to out in Colorado, 4 parts per million. 0.1 part per million versus 4 parts per million. 4 parts per million is getting up high. That, in fact, is not allowed in any water systems. That's too high. How does fluoride work? Fluoride works systemically and topically. Systemically, it works when the teeth are under the gum still, as the teeth are developing. Topically is its main way of actually helping our teeth. It remineralizes the teeth after the acid attack starts the decay process. The best way to make sure you have enough fluoride in the saliva, enough fluoride ions in the saliva that can carry both fluoride, calcium, and phosphorus back into the tooth as it becomes demineralized, is to brush your teeth well, use fluoride mouthwashes. Both of those are transient, though. They're going to be in there a while and leave, and drink fluoridated water. If you drink fluoridated water or drink other liquids that are fluoridated because of the effect of fluoridated water, or eat foods, it'll keep that saliva level up high enough so that we have a good effect. That's the quick answer.
Thank you, Dr. Brady. I guess just before we get too far into the questions, if other panelists want to chime in and sort of add to whatever the first panelist has to say about a question, feel free to do so. I have a ton of questions up here that came in prior to the start of the program tonight, so we'll work through these, I guess, until some of you folks out there decide you have some. Okay, very good. All right, well, here's one here, and I'm not sure who would like to take this one, but I'll just throw it out. Which fluoride compound will be used? Is there one that is preferable? And who is likely to be the supplier of that form of fluoride? Who would like to take that one?
I know what the most common one is going to be. The hydrofluorosilicic acid is going to be the one that probably is used here. I don't know who the supplier is. Do you know, Jason? You've got to wait, friend. Okay. Yeah. Well, actually, I'll answer that. Actually, it won't be a Chinese supplier. It's going to come from Florida. And in fact, there's a myth that it's taken from smokestacks by scrubbers. And actually, what it is, it's part of the phosphate industry that creates fertilizer. And what happens is the phosphoric acid is boiled off, and it creates, first of all, gypsum, which is used for drywalls, and it creates two other forms of acid, which are caught in water, and they are dissolved in, or incorporated into the water and become hydrofluorosilicic acid. So that's how we produce fluoride, and it'll come probably out of Florida, really. Yeah. So, Jason, please.
Just to add to that, at the request of this, the town of Bennington Water Resources Superintendent Terrence Morse looked into how other Vermont community water systems were providing fluoridation, and he contacted a series of them: Burlington, Springfield, Champlain Water District, Brattleboro Water Department, and Rutland Water Department. So Burlington, out of the 4 that he got responses from, Burlington, Springfield, and Champlain all fluoridate. Brattleboro doesn't. The other 3 used either sort of a granular form, which comes in bags, and then I can't even say how great of a job you do. Essentially, it's a liquid form. It comes in on a truck. It's basically supplied to a tank, and then that's pumped by a chemical feed pump into what we would call finished water through the distribution system, in the same way that we chlorinate. And that is from the water resources, from their perspective, that's likely going to be the style of distribution that they'll be doing. Is they'll be looking at the liquid form. It is an acid when it's in concentrated form. It's something that needs to be handled carefully. So that will help the department minimize any contact.
Okay, let's go to the first question from our audience tonight. Whoever was the brave person who asked question number 1, would you like to come up to the mic here and ask the panelists? All right. We might as well just go in numerical order here, since I don't know what the questions are, so we'll just go from basically 1 through however many. I'll sort of intermingle questions from you folks here in the audience with ones that have already been set up. Would you mind introducing yourself?
My name is Joey Culkin. I work at Fiddlehead at Four Corners. I live in Bennington. I'm running for a seat on the select board, and I'm here to do my due diligence. As a possible selectman, I want to get all the facts, yay or nay, and do my own research, and then I'll come up with an informed decision. So I've been doing a lot of research and interacting on Facebook chats, and there's one thing that keeps coming up quite a bit, and I was wondering if perhaps one of you on the panel could address it. There's a study by a Dr. Varner. People say you've got to really research Dr. Varner and the Dr. Varner and the autism and the lower IQ, and we're going to have stupid kids and many, many other things. Can one of you address that study and what it might mean, and maybe debunk myths, or if there's any validity to this study? Thank you.
Hi, so I can elaborate a little bit on the IQ study I mentioned earlier. I'll look through my notes. I don't recall which study that is, just based on the author's name, but if anyone has it, it might help me remember it. So whether or not it's going to affect IQ, and what was the other endpoint you asked about? Autism. Yeah. So I haven't seen any research trying to link fluoride with autism. So you know, when I do my research, I'm looking at peer-reviewed publications on PubMed. I know there are a lot of websites that have sort of anecdotal evidence, and that's not stuff that I really consider. But going back to the IQ study, the major one that a lot of people cite, you know, that they sort of base their concerns on IQ is the one that I mentioned from the children in China and India, where the naturally occurring levels were very high. Another thing about a lot of those studies is that they don't normalize for other factors that can sometimes lead to a decrease in IQ. So one of my major questions when I read through those studies is whether or not they've normalized for pesticide use. I studied pesticide and neurodevelopment in my graduate work, and there are a lot of pesticides that could be used in especially rural places that don't have as many controls on pesticide use as we have here in the U.S. And then going back to the study that was just published last year, I do have a few copies of that. If you want to take one, you can, but it's where they followed 1,000 people on drinking community water, fluoridated water, or non-fluoridated water, and there was no difference in IQ.
So
I could comment on that too.
And I would like to.
Would you like to? Go ahead, please. Please.
Okay. So, you know, there's a study in the critical view of oral biological medicines, and it discussed the ability of fluoride to bind with aluminum, and it created complexes that play a role not only in decreased dental caries, but it has a possibility of increasing, changing bone structure and causing fluoresis, as mentioned before, and neurotoxicity. In those situations, we're talking about levels that are higher than they're talking about adding to the water. It all adds to that question of whether we have this accumulation effect that can occur over time, or with other products that we might be using that push us into a different dose range. But when we talk about a high dose of fluoride, we are talking about doses that push above 4 parts per million, you know? So you just have to start doing the math, but the evidence is there that it can cause neurotoxicity.
I would also add that the Varner study is actually about Alzheimer's. Is what it really is, and both the Alzheimer's Association and most recent studies have shown that aluminum does not cause Alzheimer's. It's not a product. It's not a part of the problem. So the Varner study really is mute as far as causing any sort of Alzheimer problems.
in the Varner study, and that's a study in a few mice, right? Do you remember the sample size on that? It was about 12 or so. So there's sample sizes of 12 mice in studies all in medicine. I've done them myself. I think I cured diabetes in 15 mice once in Memphis. And I'm not kidding, I actually got it published, but you know, it was never reproducible because, and people move away from it. And Dr. Brady was discussing the, I think it's the Alzheimer's Association, which is a nonprofit association with a mission to end Alzheimer's. And they've noticed everyone has moved away from that topic because it wasn't reproducible. There have been studies that show smoking is good for mice. I'm not sure how that translates today in mice. So, good questions. That study is Herald, and it's got to be the only study I've ever heard about that has 15 mice that got public attention.
If I could throw one more thing into, I really do appreciate David's comment because everything is dose related here. You do have to remember dose related is the key issue here. It really is. Thank you.
Oh, sorry, if I could just add a point. Hearing you talk about it, I remembered which study that was. And the notes that I have on that study is that they looked at mice that were given either aluminum fluoride or sodium fluoride, and many of the results were specific to the aluminum fluoride group. There weren't a lot of results in the sodium fluoride group. And within those results, when you look at the two halves of the brain, there are very inconsistent changes reported from one half to another, which doesn't really make sense from a biological mechanism perspective.
Thank you. Clearly, that was a great question. Another one here from the pile. I'm not sure who wants to take this one on. How do I know if I'm getting enough or too much fluoride?
So I can take that one. I think one of the great things about fluoride is that it's one of the most studied subjects that we've had, and we see that by the recent reduction in recommended optimal level by the EPA. They've taken into account the range of amounts that people drink, and that's why it's been lowered to the optimal level of 0.7 parts per million, so that you're getting the benefits of the fluoride for tooth decay protection without the risks. So eating a healthy diet, drinking water, brushing your teeth with fluoride, which you spit out, you can get enough fluoride in community water systems that are that are adjusted to the proper dose.
All right. Who wants to ask question number 2? Who's the person? Come on up to the microphone and. Thank you. Just give us your name.
My name is Mary Garish. I'm a Bennington resident, and I use the Bennington water system. And I grew up in Michigan, which was the first state in the nation to fluoridate its water. So when I heard about this big debate, I was a bit puzzled because having grown up with it all my life, didn't understand. So I did a lot of research on it, and I appreciate all the information that all of you have shared. I want to say first, before I ask the question, that I do support fluoridation of the water for this community. I also support us taking further steps than fluoridation in oral health. But the one question that I heard that might come up, and I know this is all dosage related, so perhaps the panel could put it in the context of dosage, the concern about interaction with other meds. And is it really possible at the kind of dosage we're talking about putting in the water system that it would have any adverse effect on other meds?
So Mary, I have to say, I haven't studied exactly fluoride and its relationship to medications. I do know that there is an association with long-term ciprofloxacin use and increased fluoride. I will tell you that medications are very powerful and we try to limit them, and there are side effects that include everything from excess absorption to decreased absorption. I'll give an example. Doxycycline, which is the medication of choice for Lyme's disease, you know, when you take that, you can't go out in the sun. So you have to make that decision that when you're on that medicine, a shared decision with your physician, you cannot go out into the sun. Now the same would be true if you were on high-dose ciprofloxacin for a long time. You may have to avoid excessive fluoride. I don't know exactly what that level would be, but that's not unlike what we do with, with many medications. There is risk. Medicines are powerful and they do interact. I haven't seen anything in my prescribing history that says, by the way, make sure they're not on a fluoridated water system.
Okay. And the doctor, our physician or health provider would be aware, as they usually are, of medical interactions and be able to.
That's right, and it would be shared decision making on that.
So I dug in pretty long and hard, and I didn't find any specific medication interactions. It was clear that some of the substances that we take in will affect its absorption rate, which is what the doctor was talking about, meaning if I'm a high calcium user or a low sodium intake person, or I have access to aluminum, it may change the rate in which I take this fluoride in. It may increase its availability in my body. I found it interesting. One of the statements said, with an antacid, not to take 2 hours before your fluoride. So with water, that it's a little challenging, but I think we do have to acknowledge the fact that it does interact with the things that we ingest, and we have to understand that does happen. It's a substance. It's a product that does affect us.
Thank you. I still support fluoridation.
Thank you very much. Another question drawn from the stack. Is it possible to be allergic to fluoride? Who would like to take that one on?
I can offer a quick comment that I did not find any peer-reviewed case studies or any reports of allergies to fluoride, and I didn't find any sort of biological mechanism for that in my research either.
Just a quick follow-up, similar question. If I have an allergic reaction, what would it be?
Want to describe an allergic reaction? Thanks.
Sure. I mean, so I think the first question is not only a good one. You can be allergic to almost anything. An allergy is a hypersensitivity reaction where you get a release of histamine cells because they cross-link with antigens in your bloodstream. Everybody got that? So you can almost be allergic to anything. And so I personally have not heard of an allergy to fluoride. I'm sure someone in the world has been allergic. It would be difficult to be compatible with life because fluoride is a naturally occurring element. So most births that occur where someone is allergic to a naturally occurring element are either not sustainable or the symptoms are so minor that it enables life. So I haven't heard of it.
Time for audience question number 3.
I'm going to add just a touch to that. It's kind of interesting with fluoride because it's a recent study they found out accidentally. We're studying a lot of this with the genome product. We're learning a lot about gene expression and nutrition and foods, and basically coming back and saying, yeah, we are what we eat, or we are what we consume. We're learning that our body, through its DNA, can turn switches on and off to protect us from things like fluoride, which the body at certain levels may find toxic. So in studies by accident, they found because there was a contaminated water supply, it had fluoride in it by accident. They found that the organism was able to have ribosomal switches that change that. So our body adapts, and we do have some capacity to deal with those things. But I also found signs of allergic reaction.
Okay. Who's the person who had the third question? Sorry? Oh, okay. Then we'll go to number 4. Okay. I guess you're next. While you're here, might as well ask your question.
Good evening, and thank you, panelists, for being here this evening. I'm Dr. Alexander Tenentis. I'm a Bennington optometrist, and I wanted to ask for anybody on the panel to answer why fluoridate water when specific dosage, orally ingested, prescribed pharmaceutical grade fluoride is an FDA unapproved drug, and when you put fluoride in water, it's neither dentist nor doctor dose controlled, and so much mention in journals like the Journal of the American Dental Association, Dental Clinics of North America, Journal of Public Health Dentistry, and fluoride tout topical fluoride as being much better than systemic, and with a quote, if I may give it to you, from Doctors Warren and Levy, both dentists, by the way, from Dental Clinics of North America, 2003, issue 47. Current evidence strongly suggests that fluorides work primarily by topical means. Thus, ingestion of fluoride is not essential for caries prevention. Somebody answer that, please.
Sure. I touched on that earlier. Turn it on here. Is the green light on? Yes, it is. Okay. Topical is the main way of benefiting from fluoride. There's no doubt about that. The way it works is that as the acid that's produced from the bacteria and the sugars attacks the enamel, fluoride carries in phosphorus and calcium and fluoride to create what's called fluoroapatite, which is a harder crystal on the outside surface of the tooth. In fact, the topical fluoride treatments at your dentist actually has an acidulated fluoride. So there's an acid in the actual topical fluoride, so that the tooth itself is attacked a little bit by acid so the fluoride can do its mechanism. The point of putting it in the water systems is to make sure that the levels in the saliva stay constant enough that that effect is there. And in fact, because we've been so successful with fluoride throughout the nation, about 70% of the water systems has fluoride in the United States. Even your Budweiser has fluoride in it. And so as you have a drink of Budweiser, you're keeping that level of saliva up, and that's the whole point. It's not just the water supply, it's the other drinks and the foods that'll keep it up. We are adjusting the levels of fluoride. They were higher. We're looking for about 1 part per million now, or 0.7 part per million, because of this called the halo effect, the distribution of fluoride throughout the United States, throughout countries that use fluoride. European countries in some areas don't use water fluoridation, they use salt fluoridation, or some of them have such successful health systems that they really have full treatment of dentistry, through health means, through hygienists, that really do a lot of topical fluoride, do a lot of work with their elderly and with their children. We don't have that system in the United States. That's why water fluoridation is actually our easiest, most effective way to use fluoride for the benefit of our teeth.
Thank you, Dr. Reddy.
I think there were.
Please, go ahead.
I think there were 2 parts about the. I also saw that the FDA hadn't approved sodium. I think it's sodium fluoride as a prescription, as an approved drug. And I can't remember all of them, but the approved drug list, it's not necessary for your health, or that it hasn't been shown to be effective for what it's prescribed for. There are a number of things that go into that disclosure that it's harmful. So it's in that list as non-prescribed. I think the big thing is the FDA has basically bumped over to the EPA to make that a controlled substance, and then therefore making, like I had mentioned in my introduction, making all of us be the doctors when we make that decision to fluoridate the water.
I'd just like to add one thing to that too. Right, the certification of fluoride is not under the purview of the FDA, it's under the purview of the EPA, and it's certified by the National Sanitation Foundation. So it's very carefully regulated and certified.
Okay. Another question. If fluoridation is passed in Bennington and I don't want it in my water, is there anything I can do to remove it?
Well, it's already in the water. It's already there at 1.1 part per million. So if you want to remove it, you have to get water filters of some sort that'll do that. They're not simple to get, but it's in water. No matter what you do, it's in water. So.
Your Brita won't remove it.
The Brita won't do it. No, won't do it.
You can purchase a reverse osmosis system.
Yeah.
Okay, who has question number 6 from the audience? Still around? Question number 7, moving right along.
I'm Linda Crawford, and my medical record at the hospital shows that I did have an ER visit with a fluoride allergy. So it does exist. The hospital should be aware of it, because when I go there as a patient, they have to be very careful with my meds. My question is to the medical people and the hospital rep. Would you prescribe a medication for a patient without knowing medical history, allergies, and then force him to take it against his will? Do you practice one size fits all, or would you prescribe a medication with a different dose for different people based on factors such as age, weight, etc.? Does the hospital treat anyone without an informed consent? If I came into your ER, would I have to sign a consent before you treat me? I believe so. Then why does the medical staff in the hospital want to promote and advocate for mass medication without informed consent? It sounds so unethical to me. I just can't believe it.
Thank you.
Did I go over my minute?
Not by much.
Or would you like the question?
Who would like to take on that question?
You want me to do it, Jim?
Yeah, I
do?
think,
Okay.
thank you, Brett.
Well, first of all, it's not a medication. And second of all, Well, I'm going to explain my answer. My answer, it's not a medication. And the second thing is it's been litigated in courts, which she's brought up time and again, and the court has never ruled in favor of the idea that it's a mass medication. It's the simple answer.
Okay, where does the stuff, fluoride, actually come from? We've seen a couple of letters to the editor that say it comes from industrial smokestacks and other bizarre places, but that sounds crazy. What's the source of fluoride? How is it made?
I touched on that earlier too. I guess I'm going to talk a lot about this. Fluoride, the main source of the fluoride is from the phosphate industry. And what happens is, as they boil off the phosphate, they create the drywall, the gypsum, that's the hard product, and they create two acids which are dissolved in water and become hydrosilicic acid, and that's the source of fluorides. It's mostly in Florida at this point. In fact, Jacksonville is naturally fluoridated because the phosphate industry is located in the northern part of Florida to a great extent.
Okay, great. The person who asked question number 8 from the audience, would you like to come up and, yes ma'am.
Ann Wallace-Senft. I'm confused by why you who support fluoridation keep on claiming that fluoride is naturally present in our drinking water, which it is, in the form of calcium fluoride. It is my understanding that what will be added is sodium fluoride, which again, to my understanding, is an industrial waste product, which you have already said it was. Could you address these points, please?
When we're talking about the fluoride ion is what we're talking about, not calcium fluoride or sodium fluoride. We're talking about the fluoride ion in water, the ion itself, fluoride ion. That's what we're talking about.
I'm sorry?
You could say there's sodium chloride, there is calcium chloride, both of those in our water. There's also potassium chloride. Those are all salts, and those are all naturally existing. So sodium fluoride, calcium fluoride, those are just the positive and negative charges that form the compound, and then the separates are the minerals.
It just seems to me when you say you are adjusting the natural level of fluoride in our water, that it's a bit misleading, because I think it's just calcium fluoride that's in our, you don't find sodium fluoride in nature, I don't believe.
Fluoride as the ion is highly reactive. It attaches to almost everything around it. I mean, it creates a salt, other products pretty readily. That's what I was mentioning previously. So it does interact. It changes its look, its complex, if you will. There is fluoride that in our water at that level that we speak of. It's very minimal in the Northeast.
Okay. Another question that came in advance. How does fluoride work to prevent decay? Does it stop working at a certain point? Interesting question.
You want to take this?
Sure. Fluoride works in two ways. One, when for children, when teeth are developing, the fluoride ion is incorporated into the developing tooth, and then, as Dr. Brady mentioned, trace amounts of fluoride are incorporated into the saliva, so adults benefit as well, especially adults who have gum recession, so the roots of their tooth are exposed, and these roots are particularly in danger of getting decay, and so the fluoride is absorbed by the enamel and helps strengthen it, and also helps neutralize the acid that's created by the bacteria, so both systemically and topically, and that's one of the great things about it.
I may be able to help on that because you guys are basically saying the same thing. So I think the idea is that it's about demineralization, which is what causes our cavities. So it starts taking away or eroding, and then remineralization. So the fluoride itself ends up remineralizing, and you can do that both systemically and topically. It absorbs and creates. So we're making little holes and then filling them in, making little holes, filling them in, and that's how it works to prevent. hope maybe that makes a little message.
That's basically what it does.
Okay, question number 9. Who had that one?
Hi, my name is Ed Belzer. I'm a Bennington resident. I'm a degreed engineer, and anybody that knows me knows I do a lot of research on topics of interest to me. I've been studying fluoridation for over 10 years, since before I moved to Bennington. It's one of the reasons I moved to Bennington, no fluoridation. In the study says that fluoridation helped with tooth health, but in Europe, where there was no fluoridation, you had the same amount of improvements. And if you look at the rate of oral health improvement, it corresponded with fluoridated toothpaste, not water fluoridation. And even if you look at your toothpaste, it says, do not swallow it. Now, one of the things that people have been mentioning on the panel are peer-reviewed studies. Are there any peer-reviewed studies that show that how the water fluoridation makes a significant impact? There are no peer-reviewed studies at all that say that. Another thing, the fluorosilicic acid is a hazardous chemical. I have the MSDS right here. It's a known endocrine inhibitor. It affects your thyroid, pineal, pituitary, all your glandular systems.
Time's up, sir. Who would like to take that one on?
I'm not sure there was a question. It was a statement.
I can address some of the points. So there are many places in Europe that do fluoridate. They fluoridate their salt. So just as we put iodine in salts, they are fluoridating their water. There are also places in Europe where the naturally occurring fluoride is very high. It's optimal, so they don't need to do that. And thirdly, there's very old towns in Europe, so the very old water systems, and many people unwell, so it's not feasible to fluoridate those communities. Yeah, and your point about the toothpaste, fluoride concentration in the toothpaste is many, many times higher than what we would be fluoridating our water at. And really that's to make sure that parents are monitoring their children when they're brushing their teeth. You certainly want them to use a little bit of toothpaste, but you want them to use the proper amount, because if they can swallow it, then they can get sick from that. And lastly, as far as peer-reviewed studies that demonstrate a benefit from fluoridation, I have some citations. My remarks were too long, so I didn't get to them, but I do have some citations that I can share with you after.
I think you were going to ask a question about why the MSDS might say it's a dangerous material, because it is a very concentrated acid. So it does have to be handled with care. That means people are going to be wearing protective clothing, because if you get an acid like that on your skin, it's going to be very dangerous. But what they're doing is they're adding a very small amount of it into a very large volume of water. I would ask the engineer to explain that.
There you go, Jason.
Well, Jason, why don't you point out the fact that we're not the first town to do this. This has been doing this for, 70 years. So I am certain that there is a good process for doing such a thing.
It's an additive. This would not be the only additive that a municipal water supply or community water supply is obligated to provide. In fact, any community water supply in the state of Vermont is obligated to provide a minimum level of treatment. If you have a groundwater source, that can be as simple as a low-level dose of chlorine, which is also provided in the same way that the town does at the end of their treatment process. That chlorine is in a storage tank. There's a bulk storage tank, and then there's what we call a day tank, which is essentially the amount that you need for that day. And it's provided through the use of a chemical feed pump, a small pump that essentially places that's timed with the amount of water flowing out of the system, so that you can essentially continuously dose that supply with whatever your optimal goal is. So that's the sort of very simple answer, and it's basically going to be distributed essentially in the same way that it would be distributed in the same way that essentially the town chlorinates, which is through that method.
And would that concentration be monitored daily?
So town has what's called a SCADA system, and basically that's the brain of the treatment and distribution process, and that would essentially monitor the output and the feed at the same time, and there's a water system operator who essentially would be adjusting those feeds depending on what the demand is. Yes, there is.
How often is that monitored?
How are they testing?
Yes.
So, like, basically, you've got a sampling port that will essentially sample that feed. There's an operator in the office most hours of the day. Well, they have an operation basically, so they're more or less continuously monitoring, and so the operator is there, during work hours, and then there are essentially the SCADA will be monitoring when people aren't looking, and the town of Bennington has a nice little system where if there's any issues with anything, either treatment or distribution or sampling, anytime that there's a level that gets close to exceedance, then there's somebody on call who can port right into the SCADA system and make those kinds of adjustments. So they have a good system, and they have it's a much more robust system than many community water supplies.
Could I also comment on you mentioned the study about a pineal gland. If you look at that study, it was a study from 2001. The researchers looked at 11 different cadavers. These were people who died of old age, of mostly natural causes. And they looked at the fluoride concentration and the calcium concentration in the pineal gland. And since we know that fluoride and calcium go together, it was no surprise to find that as people age, their pineal gland does accumulate calcium. That's a normal part of aging. So it was not a big surprise to see that the fluoride did also accumulate there with age. They did not make any attempt to differentiate people based on fluoride intake. So I disagree that study showed that fluoride significantly accumulates in the pineal gland.
Okay.
I think
one more.
a couple of things. I mean, you talked about that. I mean, fluoride is highly bioavailable. I mean, like I said initially, our bodies love it. It absorbs it, it takes it in. So the concept of how much we intake is important. So, I mean, it's obvious that's why we don't swallow the toothpaste. So, yeah, I mean, if you have concerns about fluoride, it should be concerns about how much am I taking in, what that effect's going to be long term. Our bodies do absorb it. There are changes that occur if we take in too much. The other thing you talked about, the European stuff, and the doctor talked about that earlier, even the FDA in its last announcement in the Modernization Act, they sort of updated all this stuff. They concede that those initial numbers of 43% improvement in dental caries, those numbers are going to go down just because of we're now having a reduced due to other fluoridization processes like brushing our teeth and fluoride and swish and different things like that. So I think we are going to see a reduction of improvement compared to some of the older studies here in Bennington if this were to go through, just because we're using fluoride. Over.
Just to provide a gross list of providers in the state of Vermont that to provide additional treatment, which fluoridation is under Middlebury for Jens, St. Johnsbury, Burlington, Heinsberg, Richmond, Champlain Water District, Jericho, Enosburg Falls, St. Albans, Swanton, Morrisville, Newbury, Randolph, Orleans, Newport City, Poultney, Proctor, Rutland, Barry, Montpelier, Northfield, Waterbury, Bellows Falls, Ludlow, Norwich, and Springfield. So those give you the range.
I have a funny feeling our panelists will be available for follow-up questions after our show concludes tonight at 8:30, so if you don't have a chance to ask them something, you can probably have an opportunity at that point. Let's move on to another question that came in earlier. What do you say to people who are concerned about the potential environmental impact of increased fluoride in their water? Doesn't all of this somehow affect the ecosystem? Might it even have an impact on microorganisms in our environment? And last, does it create any kind of imbalance of ions that would potentially impact the environment? Who wants to be brave?
I think we would want to talk with someone in the wastewater field there. I mean, I guess the question is, where does it go when it gets flushed down down the water system? That's not something that I've researched.
You're on.
I'm not going to be able to offer a very intelligent answer to that. I will say that on the wastewater treatment side, they would not be removing fluoride from the waste stream, and as their obligations are for essentially for solids and biological oxygen treatment. And we would even love to provide tertiary treatment, but not necessarily. But that's also very costly, and that's essentially just the removal of phosphorus. And so,
Okay, we're up to audience question number 10. Who's the lucky person who asked that one? No? All right, number 11.
Hi, my name's Mary Crowley. I'm a stay-at-home mom, and I have a very simple question for you guys. My daughter, she brushes her teeth regularly. She swishes with fluoride mouthwash, and she also takes the fluoride tablets. With the fluoride in the water, should she stop taking her fluoride tablets?
Yes.
Yes.
Yes, the answer is yes. Yeah.
Okay.
She wouldn't take the flat tablets anymore.
Thank you.
All right. Here's another question that came in. Our government has in the past made egregiously incorrect claims about safety for other products. Some of those claims were affected by the industry that was producing the product. Others were not. How reliable are these current reassurances about fluoride safety? Who, if anyone, benefits financially from increased sale of fluoride for water systems? Interesting question.
I can address the work that EPA has done. I brought a couple of documents that they put out in 2010. So this is their exposure and relative source contribution analysis for fluoride. So EPA is definitely paying a lot of attention to fluoride, and what this document does is it goes through and it tries to identify all the different potential sources of fluoride and tries to estimate how much people in the U.S. can be exposed to based on our diet, based on pesticide use, based on toothpaste, etc. And at the end of this, they published this big document, and then they realized that one of the solutions to prevent any overexposure from fluoride was to revoke tolerances for the sulfuryl fluoride pesticides. So, I mean, I'm just sort of giving you that to illustrate that when the EPA did all this work and they looked at exposure and how much we're exposed to, they then took steps to reduce other potential sources of exposure to try to make sure no one was getting too much. And I don't think that anyone benefits from the sale. And I haven't seen any of that data that anyone would benefit. I don't know that one.
Okay.
Yeah, whoever sells it, but it's not expensive. It's not expensive.
Yes, Dr. Miller.
I would just add that all leading medical and science organizations support community water fluoridation. And they do it because it's an evidence-based best practice to reduce oral disease and promote oral health. And so it's not really about financial gain. Those of us that work in public health support fluoride because it's an evidence-based measure to prevent tooth decay and promote oral health.
And I'd just like to add that I applaud the person that asked that question, because we should ask that question with any change we make.
All right, audience question number 12. Who had that one?
Hi, Ted Crawford, Bennington. This is a question for the lady on the end. The question was asked, how do you know when you're getting enough, and how do you know when you do too much? You didn't answer the too much unless I missed it, which is possible. I'm a little hard of hearing.
So in reference to Dr. Voss's report from the EPA, they came up with the 0.7 to ensure that you're not getting enough. You couldn't drink enough water to get the harmful effects of fluoride. There's simply too little fluoride. I have an estimate for communities that are fluoridating at a level of 0.7 parts per million, which is what Bennington would fluoridate. It's 1 teaspoon of fluoride for every 1,694 gallons of water. So just, I guess I would refer back to the EPA's careful study, and that again, that 0.7 parts per million. And again, like I said earlier, I think it's a great testament to the fact that this is such a well-studied subject, that they have studied it for decades and have, because of all the other places that are adding fluoride to the water or adjusting the fluoride to the optimal level, reduced it to that 0.7. So that is the level.
Well, how do you know when you're getting too much? Don't you have like dental fluorosis, otherwise known as fluoride poisoning?
Dental, do you want to?
Well, before you asked that question, I was just going to add one comment that one endpoint of getting way too much fluoride, which you see from the animal studies, is the skeletal fluorosis. So that's a very rare condition to see in the U.S., so that's sort of one piece of data that you could use that could tell you that there aren't that many people that are getting that much fluoride. As far as fluorosis, I think, I have seen the data that shows 41% of adolescents have fluorosis, and that doesn't tell you if it's very mild or moderate or severe. When you look at that breakdown, you see that only about 1 to 3% of people in that age group have severe fluorosis. So, if you're thinking about fluorosis, severe fluorosis, I think, is the only one that would come close to a health effect, an adverse health effect. And when you look at that CDC data, they don't tell you if those are all people on community water fluoridation or if those are also people drinking well water. As was mentioned earlier, there are places in Vermont, people who are on well water, who have fluoride that is well above the MCL of 4 mg per liter.
Right. So how do you know when you're getting too much? What do you feel sick?
It's not expected that people who drink community water, water fluoridated through a community water fluoridation system would be getting too much.
Okay.
Fluorosis occurs when you reach levels above 4 parts per million. Am I stating?
That's one way to interpret it.
Yeah.
This is what fluorosis is. This is I'll never get that down pat. But that's what fluorosis looks like. There is moderate fluorosis, which is a chalky white look, like that, upside down. And this is the brown teeth. This is severe fluorosis. And this is not very often. You see this in areas where it's 4 parts per million and above. And that's what fluorosis looks like. So you know.
Okay, next question is, why isn't the Bennington Oral Health Coalition doing school-based nutrition and oral health education for parents instead of focusing on fluoridation?
I'm sorry, I spent my question on. What was the question? Can you repeat it? I missed it.
You want me to repeat it?
Yeah.
Why isn't the Bennington Oral Health Coalition doing school-based nutrition and oral health education for parents instead of focusing on fluoridation?
Robin, you want? But she's part of the health board.
I'm happy to respond to that, but I'm not a member of the Bennington Oral Health Coalition, so if someone probably would be.
Mary Lou's the chair of the Bennington Oral Health Coalition. It's probably smarter. Yeah.
Come on up to the microphone then.
I'm number 18, so I can use this as
Oh, perfect. Kill two birds with one stone then. Personal figure.
The Bennington Oral Health Coalition is trying to do programs. We have been talking to schools, we've been talking to other groups to get in and do education. So we are working on that, but we are doing it on a volunteer basis. So if anybody thinks that there should be more people in the schools, show me the money. The state oral health department we have a hygienist in the schools. We have Meg Outwater. She is in the schools doing different programs. So there is a program in the schools. I would like to ask the people who maybe don't want fluoride, what are they going to do? Are they going to help with such programs? Thank you.
All right, now we're up to audience question number 13. Who had that one? Questioner number 13?
I apologize. I was told that was out of line what I said. I apologize.
Okay. Question number 14. Anyone? Question number 14. Going once, going twice. Number 15. I feel like I'm at an auction here. Come on up.
My name is Lauren Starkey-Kreuter, and I'm a resident here in Bennington on town water. And I'm actually finding it kind of difficult to stand up. I disagree with this. I'm against putting not natural calcium fluoride into our water, but the hydrofluorosilicic acid fluoride. That interacts in our bodies in a different way. That's not my question. My question is about basically the Facebook page of the Bennington Oral Health Coalition has been a place where there's been lots of conversation and posting of information. And my question is, why have studies been removed from the page that have been shared, that have been, peer-reviewed journals? If we're a community who really wants the best for ourselves, for our families, for our entire community. I would love to just totally agree with Charlie and the whole movement to do something that sounds like it could be really great. Why do we remove information so we can't have a full, open, transparent conversation all together to find the best up-to-date information?
I don't have an answer, but just an answer to the comment that the hydrofluorosilicic acid is going to react differently in your body. That dissociates in water, so you're just going to be left with the fluoride ion, not the acid when it enters your body.
That's just not the way it works, but it's the fluoride ion we're talking about. That's all right.
You might be able to quiz some members of the panel after the program's over. Moving on to our next question. Why can't I add fluoride to my own water? Sort of a do-it-yourself approach. Is that possible?
I'm sorry. Who does the Facebook page? I think she needs an answer to that question.
Anyone in the audience have?
I've become the de facto person for Facebook, apparently. We have a policy, a new policy. Let me start over. On December 31st, we were flooded, and flooding is when you get hundreds of people commenting on your page on Facebook. We were flooded with rhetoric for the most part. Some of it was studies. And we changed our policy on that day because we are very busy trying to address the concerns of Bennington residents, and we were flooded with information and rhetoric and hate mail, really, name calling on that date. So we changed our policy to be that we will not respond to and allow people who are outside of Bennington to post negative information on our Facebook page, because it's our Facebook page, so we basically can do what we want. We want to respect the comments from people in Bennington, but we eliminated the opportunity for other people to post on our page. If you have questions and want to send them to info@benningtonoralhealth.com, we can address your questions that way. If you have concerns that you want to use as comments on what is posted, we can address your comments that way. But we will not accept anything to our Facebook page that is a negative comment from anyone outside of Bennington, because we just don't have time for that. We are volunteers, and we will not allow anyone at all, to post anything independently onto our page. If you really want something to go onto our Facebook page, you have to send it to me via the message system through Facebook.
So essentially, it's not an open forum. That's what you're saying. It's not an open forum. Okay.
Okay, thank you. So back to that other question then, why can't I add fluoride to my own water? Now that you've all had a chance to think about that one, how would that work?
Well, you have to buy fluoridated water. You have to buy bottled water with fluoride in it. There's no way to doing that safely individually. Yep.
So don't do it yourself. Up to question number 16. Who's the person who had that one? 16.
Hi, Kathy Hoisington. My bias is definitely for fluoridation. I'll start with that. And I would also like to share with you that I come from very conservative politics. I don't like big government. I don't like government regulation. The less, the better, as far as I'm concerned. But I think we have a community responsibility. These are our children. And we're out of control. And unless we can clone Dr. Brady 10 times over, I think we ought to put fluoride in the water. My question is, how long would we have to have it in the water before we could see some real positive or other effect?
You know that better than I do. Yeah.
I was just thinking that's a great question. I think in terms of the adults and the benefits of the systemic fluoride, you'd see that right away. In terms of, I've got the latest oral health of Vermont's Children report right here, and to be honest with you, I was concerned when I looked at Bennington's results. In terms of how long it would take for us to see results with an oral health survey, I was going to say, if you started fluoridating now, perhaps we do the survey every 3 to 5 years, so
all right.
maybe see some results
So
by
make
then.
a 3 or 5 year commitment and trust our doctors and our scientists that have told us this is worth the effort, and think of our children. And if it doesn't work, you can take it back out of the system.
Thank you, Kathy. Here's another question that arrived earlier. Are there any studies that lead you to believe that fluoride is unsafe? Any studies out there that you've read that raise that question?
I think one of the concepts we have to keep in mind is the concept of dose. So if we were talking about adding fluoride at 7 parts per million or 10, that's a very different situation than adding fluoride at 0.7 parts per million. So at 0.7 parts per million, there are no studies that make me think that fluoride is unsafe in your water.
Okay, question number 17 from the audience. Who had lucky number 17? Number 18. I know you're there someplace. Oh, right. We've already had your question. 19. Number 19. I'm getting to the point where I can't count that high. 20.
I'm Abby Shapiro. I live here in Bennington. I do not want to drink fluoride. And having said that, I would also like to say that, didn't your mother ever tell you that just because everybody else is doing it is not a good reason? So having said that, each of you are part of organizations or medical practices that serve the region, not just Bennington residents. And a large group of the people you serve are not drinking Bennington municipal water. And so the numbers that the Oral Health Committee puts out are a little skewed because they're alarming, but they're misleading because Dr. Brady is seeing children outside of the community. So is the hospital. Bennell, Molly Stark, and Shaftesbury are only a sampling by the Vermont Department of Health in their report on dental decay in elementary-age children. They were the top 3. Number 5 was Burlington's Edmonds School, and Burlington's been fluoridated since 1952. Number 6 was Swanton. Oh shoot, already? Why aren't all of us going to the state and demanding that there be a regional solution, because fluoridating Bennington's water will reach an incredibly small quantity of the children in need?
What is the question, the ultimate question there?
The question is, when fluoridation reaches such a small part of the region, and the region is in such a desperate need, it doesn't reach Shaftesbury, doesn't reach Powell, doesn't reach Woodford, and these are all children being served by Dr. Brady's clinic and by the hospital. Why isn't the state doing something to save themselves money in this embarrassing corner of the state?
It's my understanding that this water system is actually quite a large water system. So, but by Vermont standards, it's a large water system. And community water fluoridation is a cost-effective way to reach all members of the population, regardless of age or socioeconomic status. So it's the most effective way to prevent tooth decay on a population level, and that's why the health department supports it.
Maybe the select board would know the number better, but if I remember right, Lisa, maybe you could help me. Is there about 20,000 people in town and 12,000 are on the water system? Is that about right? 15,000 in the town? 15,000 in the town and 12,000 are on the water system? Is that the right number? It's pretty close to 12. It is. Yeah, in the town of Bennington, it is, yeah.
3,700 connections in town water.
That's 12,000 people.
There are 5,700 on the grad list.
That's the residents. That's residents. We're talking about people. Yeah.
Perhaps you'll have an opportunity
I should
to
have
discuss
that number ready. I
uh,
apologize not having that number ready. It didn't dawn
Okay.
on me.
Might be able to follow up afterwards. Here's another question. In a society with other sources of fluoride, such as toothpaste, what is the recent evidence that fluoridated water is still effective? Dr. Miller.
Well, not a doctor, but thank you. So the study that I was referring to earlier is from 2014, and there are many, but I have 2 cited here that I can share. One was a study in Nevada that showed that not having fluoridated water was one of the highest risk factors for tooth decay, and the second one took 2 towns that were similar demographically, and one was optimally fluoridated, one was less than optimally fluoridated, and the water fluoridation reduced dental caries by 33%.
Okay.
I can comment. The EPA does, and I commented on it earlier, the EPA does say that that fluoridation is showing a reduced effect over time due to the availability of other fluoride products. So as we get more fluoride outside of our water, the effect or the decrease in dental caries just from fluoridation will decrease as well.
Question number 21. Who had that one? No. 22. Going once, going twice. 23.
Like Abby said, just because everybody else is doing it, should we do it? And I think that's a misleading statement. All I hear about is peer reviews. I just want to, Albany, New York is the capital of New York State, home of the Albany Medical Center, Albany Medical College, Albany Pharmacy, Albany Law School, etc., etc. I dare say that we have more doctors per capita in Albany than we do in Bennington. I just want to read this letter in part. It is the board's judgment that there is insufficient evidence to support a decision to fluoridate our drinking water at this time. Indeed, there is considerable new information which indicates that there may be serious health implications to fluoridation, especially with regards to the new findings by the National Academy of Science National Research Council. The board also believes that the board also believes that there is sufficient other means available to obtain fluoride for those wishing to do so. My question is, I never heard this mentioned in any of the debates. Is this just poppycock, or does it have any credence at all?
What is it?
It's a research, it's a fluoride in drinking water, a scientific review of the EPA standards. It was printed by the National Research Council of the National Academy of Sciences.
Yeah, so that is a very credible source and a very credible review. But the question that they were asked is whether they should advise the EPA to lower the MCL for fluoride in drinking water. The MCL is 4 mg per liter. And if you look in the introduction of that big long report, it does say that that report does not address community water fluoridation. It's a completely different question.
We shouldn't, before, I mean, a prestigious community like Albany decided not to fluoridate, shouldn't we in Bennington look at this a little closer before it goes for a vote? It's just unbelievable.
Can I make a comment, please? There's another prestigious organization, the Department of Defense, that's put out a letter that has mandated that all Army bases, all Navy bases, all Air Force bases with water systems up greater than 3,000 people on it have to be fluoridated. So there's other authorities out there beyond the Water Board of Albany.
Just wanted to say the last 5 minutes of our program tonight will be a wrap-up session for the panelists, so we have time for like maybe 1 or 2 questions. We've run through all the questions that we've gotten in from the audience, but we have a couple here that touch upon a subject to my shock and horror, did not get to yet, and that's something we're all interested in. Taxes. What is the estimated cost to taxpayers if we fluoridate? Any financial analysts up here?
I don't have the numbers of this at this point, but the cost per person on a water system is somewhere between 50 cents and $3 per year, depending on the size of the water system. But I don't have the local numbers at this point because it hasn't been voted for and we haven't talked about equipment.
I can give a brief overview of what the towns looked at, and they've done essentially they've looked at what their investment potential investment, capital improvement cost would be, and then what their daily cost would be. And there is a question as to whether there would be need for a small either outbuilding or building expansion, and that's not in this price and is not known at this point. Terry did a pretty decent job trying to track down good numbers, but at this point, until there's a real direction from the voters, he's not investing a lot of time beyond that. But basically, the equipment costs, as I mentioned before, basically it's a bulk storage tank, it's a day tank, it's a couple chemical feed pumps, and then operating. Basically, they would tie that hole into the system, and then they would also have some operator training, which would come to in the range of about $18,000 is what he estimated for that equipment. And then from an operational standpoint, based on what the other suppliers or other water treatment facilities are getting, just to give you a range of size, Bennington is a 3 million gallon per day. Burlington averages about 4.5. Springfield averages about 1 million. Champlain averages about 9. So based on what those estimated costs are, they're about $20 to $25 a day. So range that over 365 days. I can no longer do math, so I can't do that in my head. So I have the calculator. So. 6 to 9 grand a year.
And sort of a follow-up question to that, do we pay for this as water rate payers, or does it come from the general fund?
It would be a part, as far as I understand it, it would be a part of what's called the enterprise fund, which is the water fund.
Okay, at this point, I guess we're just about down to the last few minutes here. 5 minutes or so for wrap-up comments, concluding comments, final thoughts from our panel. Who would like to start? Down at the end?
Well, I just want to thank you for inviting me to be here tonight. As I had said before, at the health department, we support community water fluoridation, but respect that this is your decision to make. So I think it's great and that you're having questions, and hopefully you got some good answers here tonight. Thank you.
My real comments are about how proud I am about this community. The fluoridation discussion in other communities has not been as civil as this, has been more divisive, and really gotten ugly. And although there's been some commentary in the banner and there's issues with the Facebook pages and things, tonight I'm really, really proud of this community. We came forward, we asked tough questions, and you got sensible answers. Maybe not always the answers you wanted, but you got good answers. The most really important thing is when I'm trying to make a decision, oftentimes I turn to different people for advice. If I have a car issue, I don't turn to my doctor to ask my doctor about cars. I turn to a mechanic. If I need health issues, I turn to my doctor. If I have dental issues, I often turn to my dentist and ask the question there. I'm hopeful that tonight, as you think about this question of fluoridation, you're turning to the experts, just like you would in the rest of your life. We got taxes coming up. Hopefully you're turning to your tax people for advice there. So turn to the people that are the experts that can give you real clear information, and hopefully you'll be able to make your own mind up in the end. But that's what tonight is about, and I'm really, really proud about this community. So thank you all.
My only comment, if anyone has questions about studies or health effects that we didn't discuss tonight, I'm available, and I can give you my email address as well, or phone number.
I want to thank you for the opportunity to talk about this again. No matter how this turns out, we certainly have raised the issue of oral health and raised the awareness of it in here, and both sides agree with that we do really need to answer our oral health problems. Fluoride is not the only answer. I certainly agree with everyone about that. There's a lot more things we need to do beyond water fluoridation. European countries have a health system that does a much better job than we do. And we wouldn't be talking about water fluoridation if we had Finland's system, but I won't go into that at this point. Thank you very much for the opportunity to talk about this again.
Just real quickly, what this exercise brought around to me, I'll go back to those same questions I had in the beginning. When I asked myself, can be helpful in preventing this problem, I mean, yes, I mean, obviously that it can help prevent dental caries. The second question was, there is a potential problems long and short term. Yes, there are potential problems. We're not sure what the long-term effects of fluoride are on our body, and it's highly bioavailable. A lot of questions to be asked concerning that. Does fluoride interact with our other medications or foods? It does. So we have to think about those levels of fluoride. We have to really think about what we'd like to do for our community and friends and neighbors and make decisions. I'm a Bennington resident as well. I'll be voting on this.
So I'd just like to say it came out some tonight, but I know it's in people's heads, and I applaud it, and I think it every day, and that is whenever there's talk of change, I want to know who's benefiting from that. And I think about that all the time when I see patients, because the pharmaceutical industry has hurt the medical industry reputation by benefiting. And so we're very aware of that. I make those decisions daily, and I can say there is no secondary gain here other than improved health care, and that's the whole idea behind public health.
I had one follow-up thought with respect to environmental effects, and it's a bit of a non sequitur. And I guess, and this is not to say that I, there again, have any strong opinions either way, but if for those of you who are worried about environmental effects of any change in the water supply and thus through the wastewater treatment system, we have really, from my experience, we have really big, much bigger questions out there with respect to inorganic compounds that we're creating and trace pharmaceuticals. Sorry, doctors.
I agree.
And these are questions. Those are much bigger issues that we haven't answered. With respect to the water department, I've had the pleasure of working very closely with the water department that serves the Bennington community, and I would just like to say that they're really responsible and attentive staff, and they're really they take their jobs very seriously. So it's I think that they are here to serve you, and that's what they do, and they do it well every day.
Okay, well, that about sums it up. If there are, I'm sure our panelists will be around for a few minutes to answer any follow-up questions you might have. I just wanted to thank the members of the audience for asking some great questions, and the Bennington Oral Health Coalition for organizing the forum.
I'd like to add just a couple thoughts. One is I'd love to have a round of applause for our experts tonight. A bunch of them have come from very far away, so thank you very much for your... So we have some big problems with oral health here in Bennington. You've heard the recommendation of the Oral Health Coalition. We feel that science is on the side of fluoridation, and we hope that you will support that. I do want to point out that there are, that March 3rd is town meeting. Please come out and vote. We are a democracy, and this is the way we get what we want in our democracy. If you'd like to sign up for an absentee ballot, you can do so at the back of the room. And thank you very much for coming.